what I would advise someone is to find the right treatment provider. I had issues finding that person. The first endocrinologist I went to, I was concerned about the HypoPARAthyroidism. He heard about the thyroid cancer, and all he wanted to talk about was the thyroid cancer. And as far as I was concerned, that was taken care of. And I really couldn't get him to even really consider the HypoPARA. So, I mean, but once I got to a doctor who really understood the disease, things really turned around. So that's, to me, it is the best thing you can do for yourself, is to find someone that really understands the disease and knows how to treat it. As a doctor myself, I can say that you don't see hypoparathyroidism. You hear very little about it in medical school, in your training. So you don't tend to know much about it. I mean, you have to try to, you can only remember so much, so you remember the things that you see on a day-to-day basis. You may, in the back of your mind, have an idea what what hypoparathyroidism is, but you really don't know the full spectrum of it, and you don't know how to treat it really effectively.
My advice to a recently diagnosed patient would be to find a doctor that you have a good relationship with. Because if you don't have a good relationship with your doctor, you're not going to get anywhere. You're always going to be feuding, you're always going to be arguing. You need somebody that's going to listen to you, that's going to explain to you what, like if you get your blood calcium, you get your blood test results, they do a full panel on you. If you have questions and you want to be able to ask the doctor all these questions and they can answer these questions on a positive basis and explain to you what everything means and how that affects your well-being. Because if you don't have that good patient-doctor relationship, you're not going to get anywhere in your care.
My advice to someone that's recently been diagnosed would be to take ownership of your health. Don't depend on the doctors. Do your research. Ask the questions. Because you need to be responsible for your own health and don't depend on them. Because what I've found is a lot of doctors are not familiar with it. Even endocrinologists, they have to do their research. So it's up to me to ask the questions. Even from this conference, I've already got my questions to take back to my doctor. And when I told her that I was coming, and she asked me, says, please bring me back all the information you can and please share it with me so she can learn. So always, take ownership of your medical health and ask the questions. If you're not sure what to ask, go to the website for the association. There's a lot of helpful information there and other people to talk to.
The advice I would give to somebody that's got hypoparathyroidism is to become informed about the disease, become their best advocate. Don't leave it up to the physicians. Do the research. Speak to people that have been down the road, people like Jim Sanders and other people you meet at these conferences, but become informed. That knowledge is going to give you the power you need to direct your treatment. You can't rely on anybody else to do it for you. You have to take control of it. Everybody is different. And what people need to understand is they need to find a doctor or doctors that will tailor a treatment plan for them. There is no magical chart that says, you're 5'2", 150 pounds, here's your medication, here's your treatment plan. It's something that needs work, and it needs collaborative work with you and the doctor in order to get it right. And it takes time. It doesn't happen quickly. For me, it took quite a while before I was stabilized, and it was over a year before I could really say that, I'm kind of, for what I can be, in balance. You just have to realize that, and you have to work at it. It's not going to come easy. You can't go to a doctor and just expect them to go, here you go, you're going to be all better. It's going to be a collaborative effort, and you're going to have to work at it. But if you do work at it, and you find a doctor who's willing to work with you, it can be done.
If I were talking to a recently diagnosed patient, I think I would tell them that they need to be their own best advocate, because this is a rare disease, and many doctors will not have a lot of experience with it. So I think I would tell a recently diagnosed patient that they need to learn about the disease, this HypoPARAthyroid Association is a great resource. And I would also tell them that they have to advocate for themselves with their doctor and look out for their own health, and be in tune with their own bodies, because everybody's body's reacting a little differently, different things that work for different people. So I think they'd have to be their own advocate and learn their own signals.
As far as advice, to a recently diagnosed patient, I would certainly tell you to be strong and stay positive, as hard as it may be. I know and I understand the pain, and I understand the fatigue and the weakness in your lifestyle and your quality of life and how everything can be affected. I understand firsthand what that's like. But as far as advice, the only thing I can advise from personal experience is to stay strong and stay connected with other people, and any information bring to your doctor. If your doctor's not responding properly and you feel like you're not getting the right care, go to the next doctor. Go to the next doctor and the next. Don't give up. Don't let somebody tell you something that you know in your gut to not be true. Keep going, don't give up, but stay positive while you're chugging along.
If I were to give anybody any kind of counsel, I think what I would say is join the association. Knowledge is power. And until having joined this association, I was kind of swimming in a pool of insecurity, but I'm feeling with the information and the knowledge that I've gained, I feel that I'm empowering myself. And I'm probably going to be a much more informed member of my medical team with those doctors that are treating me.
I began to learn and become a more proactive patient, and that's what I would recommend. Find out all you can about your personal symptoms and what hypocalcemic actually means.